Diabetes mellitus type 2. It's an metabolic disorder. Look at this picture, shows that stomach, pancreas, insulin production. A detail going on. Introduction. Diabetes mellitus type 2 T2DM is a chronic metabolic disorder characterized by insulin resistance and relative insulin deficiency. It is the most common form of diabetes, accounting for approximately 90 to 95% of all diabetes cases worldwide. Definition: T2DM is defined by elevated blood glucose levels due to combination of resistance to insulin action and an inadequate compensatory insulin secretory response. This condition leads to chronic hyperglycemia and various long-term complications. Types. While T2DM is generally considered a single disease entity, it can be divided into various subtypes based on different criteria. First criteria: genetic predisposition. Some individuals have a strong genetic compounds contributing to insulin resistance. Second, lifestyle factors: poor diet, sedentary lifestyle, and obesity. Three, secondary diabetes resulting from other conditions like polycystic ovary syndrome or use of certain medications like corticosteroids. Causes. The exact cause of T2DM is not fully understood, but it involves a combination of genetic, environmental, and lifestyle factors. 1. Genetics. Family history of diabetes increases the risk. Second, obesity. Excess body fat, particularly abdominal fat, is a major contributor. 3. Physical inactivity. Lack of exercise contributes to insulin resistance. 4. Poor diet. High intake of sugar, fatty, and processed foods. 5. Age. Risk increases with age. 6. Ethnicity. Higher prevalence in certain ethnic groups including African Americans, Hispanics, Native Americans, and Asians. Risk factors. 1. Age. Older age is a significant risk factor. 2. Obesity, especially central obesity. 3. Family history, genetic predisposition. 4. Ethnicity, certain ethnic backgrounds have higher risks due to food habits and culture. 5. Sedentary lifestyle, lack of physical activity. 6. Unhealthy diet, high in calories, refined sugars and fats. 7. Hypertension, high blood pressure. 8. Dyslipidemia, abnormal cholesterol levels. 9. History of gestational diabetes, women who had diabetes during pregnancy. Complications: microvascular complications. 1. Retinopathy, eye damage that can lead to blindness. 2. Nephropathy, kidney damage that can lead to kidney failure. 3. Neuropathy, nerve damage that can cause pain, tingling and loss of sensation. Macrovascular complications. 1. Cardiovascular diseases, increased risk of heart attacks and stroke. 2. Peripheral artery disease, poor blood circulation in limbs. Other complications: infections, increased susceptibility to infections. 2. Skin conditions, various skin problems. Pathophysiology: T2DM results from combination of peripheral insulin resistance and an inadequate compensatory insulin secretory response by pancreatic beta cells. This leads to elevated blood glucose level. Chronic hyperglycemia causes damage to various organs and systems through mechanisms such as: 1. Advanced glycation end products. Proteins or lipids that become glycated after exposure to sugar. 2. Oxidative stress, increased production of reactive oxygen species, ROS. 3. Inflammation, chronic low grade inflammation. Signs and symptoms: 1. Polyuria, frequent urination. 2. Polydipsia, excessive thirst. 3. Polyphagia, increased hunger. 4. Fatigue, persistent tiredness. 5. Blurred vision due to high blood sugar levels. 6. Slow healing of wounds and infections. 7. Unexplained weight loss despite increased appetite. 8. Numbness or tingling, especially in hands and feet. Medical diagnosis: 1. Fasting plasma glucose, FPG, more than 126 mg per dl. 2. Oral glucose tolerance test, OGTT, 2 hours plasma glucose more than 200 mg per dl. Three, hemoglobin A1C, HbA1c more than 6.5 percentage. 4, random plasma glucose more than 200 mg per dl. In the presence of classic symptoms of hyperglycemia. Nursing diagnosis: 1. Risk for unstable blood glucose level. 2. Imbalanced nutrition more than body requirements. 3. Deficient knowledge. 4. Risk for infection. 5. Risk for peripheral neurovascular dysfunction. Management and treatment: lifestyle modification, diet, balanced diet with controlled carbohydrate intake, exercise, regular physical activity, weight management, achieving and maintaining healthy weight. Pharmacological therapy: metformin first line medication, sulfonylureas increase insulin secretion, triazolidinedioneus improve insulin sensitivity, GLP-1 receptor agonists enhance insulin secretion. DPP-4 inhibitors prolong action of in certain hormones. SGLT2 inhibitors increased glucose excretion through urine. Insulin therapy for advanced cases. Monitoring: regular blood glucose monitoring, routine follow-up visits, monitoring for complications, psychosocial medicine. Psychosocial medicine including: 1. Support groups, participate in diabetes support groups. 2. Mental health counseling for stress, anxiety or depression associated with chronic diseases. 3. Education, patient and family education and disease management. Prevention: 1. Healthy diet, consuming a balanced diet rich in fiber, vegetables, lean proteins. 2. Regular exercise, engaging in at least 150 minutes of moderate intensity exercise per week. 3. Weight management, maintaining a healthy weight for regular screening for those at high risk. Conclusion: diabetes mellitus type 2 is a complex and multi-factor disease. Requires a comprehensive approach for management and prevention. Understanding the underlying mechanisms, risk factors and treatment options is crucial for effective control and reduction of associated complications. With proper lifestyle modifications, medications and psychosocial support, individuals with T2DM can lead healthy and productive lives. Thank you. Have a nice day.